Welcome to Garden of Fertility. My name is Opera Stella Thelma, your fertility counselor. I'm a medical lab scientist by profession. So today we are going to be talking about questions your doctor may ask you or your healthcare provider may ask you if you are having a fertility challenge. Questions you should be expecting. Number one is if you have had a previous pregnancy or a child before. Now the question will go to if you have given birth before, whether you have any complication, miscarriage in that previous pregnancy. If you are a man, you'll be asked whether you have pregnanted a woman before. So all this record need to be taken. Number two question you should expect is how long you have been trying to conceive. How have you been trying to do this? The journey so far, whether there is any medication or any encounter on this process. There is also a need to take note of that. Number three is your sexual life. How often do you have intercourse with your partner? Whether you have pains or difficulties during sexual intercourse. You may feel embarrassed or uncomfortable discussing all this with your fertility specialist or your doctor. As a fertility specialist, I have to advise you, you need to be open and be honest in every question you are being asked so that your challenge can easily be traced. Therefore, if the fertility challenge are linked with sex, it can easily be overcome. Number four is length of time you have stopped conception. The type of conception you used previously and when you stopped it. It's also very essential to take note of that. Number five is medical history. Whether you have been diagnosed in the past with sexual transmitted disease and how you handled it, whether it is properly treated, regular period, whether you experience bleeding between period or after sexual intercourse. Number six is medication. Some medication can affect your fertility unknowingly to you, especially those who take these steroid drugs without prescription. It can cause more harm than good to your fertility. You have to disclose the medication you are taking, and she or he may suggest a better medication you can take for a better treatment options. And don't forget, you have to mention other non-prescriptive medication you are taking, like herbal medicine and supplements. Finally, your lifestyle factor. Your lifestyle factor have a major role to play in your fertility. I always encourage people, when you are in your reproductive stage, you need to be mindful of what you do and what you eat. Your input determines your output. A lot of people have formed a lifestyle habit that have affected their journey to parenthood unknowingly to them. Therefore, several life factors can affect your fertility. The doctor might like to know, number one, if you're smoking, your body weight, how much alcohol you take, whether you take illegal drugs, and your stress. All these things need to be considered. After asking you all these questions, physical examination can be referred, like taking some fertility tests. If you are a female, your weight needs to be checked if you have a normal body mass index. Examination of your pelvic area to check for an infection, lumps, or tenderness, which might be a sign of fibroid, endometriosis, pelvic inflammatory disease, or ovarian tumor. So all these are part of the physical examinations that need to be done. Wait for our next video to know the fertility test you need to undergo as a woman or a man.